I think it looks like it's right at noon on the dot. So I'm going to get us going here and just personally want to wish everyone a happy afternoon and welcome to the first virtual Women for Good meeting. As I said earlier, we really miss not being together and enjoying, of course, our yummy lunch and conversation to start us off. But in the midst of our pandemic, we just felt like this was the only safe option for us. And we're just, again, happy to be able to be together virtually this afternoon. So I want to just give you a quick update. I know so much has changed since our February meeting. We hope you and your loved ones are all staying safe during this difficult time. And I just wanted to share with you a couple quick updates on the foundation and our role during COVID-19 and the response. First of all, 8 of our 12 staff are working remotely, and that's just going very well. We were well prepared with technology and other resources to make the transition pretty seamless. Liz, Nikki, Tom Wickersham, and myself have remained in the office with our community space closed, of course. But having some staff in our office has certainly been a blessing as we've continued our operational responsibilities, as well as opening 12 COVID-19 response funds across our region. So this includes opening a collaborative fund here with Blackhawk County funders, and they have contributed to our cooperative fund, and we've raised nearly $350,000 in contributions to date just in that fund. And then our foundation, I feel like, has really strengthened our role as a community leader and convener here in this response time, and we're all really proud of those efforts. We're also blessed to be a part of the important work that provides community members the opportunity to financially support the vital nonprofits in our region, and especially that frontline response is really what we've been targeting on. And so to date, across our region, we've raised nearly $550,000 to provide impactful grants to support our nonprofit response. And $350,000 in grants has already been distributed to those important nonprofits. So we modified our grant making approach so we could be more nimble and streamlined and really fast track the application process for our nonprofit partners so they could really concentrate on what they needed to be doing in the response. So we're really proud of that. And we really just want to take this moment, I guess, to thank each of you for the nonprofit support that you have been provided, and financially sharing contributions, volunteering, prayers, whatever it has been. We really feel like it takes our whole community to respond. And I've just really been so energized, I guess, and lifted up by our nonprofit partners. When I talk with their leadership and I meet with them and I'm learning about what they're doing in this really difficult time, their strength and resilience for our community is just so inspiring. And it's just really been an honor to be a part of and to witness that important work. So we just really encourage each of you to continue to do your part. I know you will. Reach out with a note of thanks to a community partner, or volunteer if you can, or bake cookies or a pie, like some people do, right? Send a contribution. This pandemic really is literally affecting every nonprofit in our region, and we know it's going to take a village to really help stand them back up again and continue to serve our communities, and I know they will. So I'm just so happy and proud that we can be a part of that work, and I know you are as well. So I'll go ahead and turn it over to Nikki, who has some program updates, and then we're going to get to our inspiring program.
I am Nikki Litzel. I'm the Director of Development here at the Foundation, and I am just going to do a couple of updates and housekeeping items. Number one, if you are a member and have not paid your dues, this is just a little gentle reminder to get those paid. You should have heard from us if you do have some outstanding dues. But if you are new to us, as we have the opportunity, especially with Zoom now, we have a couple of new people that are interested in joining us. If you're interested in becoming a member, you are definitely welcome to do that. And the dues for that are $150, and $100 of that actually goes into our Women's Fund for grant purposes. And you can learn more about that at our website or contact me directly. Speaking of the Women's Fund, we had our 2020 grant application open up just recently on May 10th, and it will remain open through July 31st. And for those of you who don't know, the purpose of the Women's Fund grant is to benefit women and girls in Black Hawk County. So we have some organizations, a handful, that have started filling out those applications. And again, those will be available and open up through July 31st through our website. So if you know of any organizations who may be eligible for that, you may want to reach out to them and make sure they're aware. We've definitely been marketing it and reaching out to our nonprofit partners, but especially during this pandemic, I think we'll see probably an increase in need with those, especially with those organizations with women and girls. Also, regarding the Women's Fund, we have a match campaign that is still available. So any gifts that are made to the Women's Fund will be matched dollar for dollar up to $75,000. We've had some generous members who have contributed that match fund, and we are really looking to grow that endowment, and this is a great opportunity. So if you do have the opportunity to increase your gift to the Women's Fund, just know that it will be matched up to $75,000 currently. Okay, housekeeping items. During this program today, we have a couple of guest speakers who I will be tossing it over to here shortly, but if you have any questions throughout the program, I encourage you to put those in the chat box, and we will definitely try to answer those questions afterwards. And also afterwards, we'll have some time for question and answers, and you can ask those directly. Otherwise, I would ask that you make sure you're on mute, so we don't have any background or feedback or anything like that while you're listening to the program. So if you can make sure you're muted until it's time for those questions and answers if you have any questions. So now I will introduce our speakers. The past several weeks during this COVID-19 time, providing childcare for important medical personnel and first responders in Black Hawk County has become a priority. The Black Hawk County Child Care Response Initiative was established to organize emergency childcare to support our community's essential workers during this time of increased need. We are fortunate to have members of the steering team with us today for our virtual Women for Good meeting. 4 members of that steering team have been meeting on a regular basis, and Jane Lindeman, from Superintendent of Waterloo Schools, Pam Ziegler, Associate Superintendent of Cedar Falls Schools, Mary Jansen, she's the Child and Family Services Director of Childcare Resource and Referral of Northeast Iowa, and Angie Whitner of the Black Hawk County YMCA. Mary and Angie are both with us today, and I will now toss it over to Mary, who will be taking over from here.
All right, thanks guys. Great to see everyone. Angie and I are excited to be here today. We had originally planned that the 4 of us would be here, but Pam and Jane's schedules just get a little crazy, and we told them we definitely could cover this, and we would tell them all hello, or tell you all hello from them. So they send their best, but definitely had a lot, they have a lot on their plates too right now. So we're gonna kind of just talk a little bit about what we've been doing in the last several weeks, introduce ourselves. I'm gonna share my screen so you can see a very basic PowerPoint that I have put together really quick, and see if I can find it. We basically have done a lot of things just looking at what's needed for childcare in our community. So let's first have Angie. Do you want to go ahead and introduce yourself while I get the screen ready, and then I'll do a quick introduction of myself?
Sure. Hello, everybody. Thank you for having us. My name is Angie Whitner, and I'm the CEO at the Family YMCA Black Hawk County. And our role in this has been basically since spring break, and since schools were postponed, we stepped into emergency childcare efforts here at the Y. At the same time, our facility closed for general member use, and so we essentially converted our facility further. You know, we do camp and childcare on a regular basis as well, but we kind of expanded that out and transitioned a lot of spaces within our facility to be prepared to handle more kids in the emergency childcare setting. So we have convened a group, and I think Mary's going to put some of that up to demonstrate. And so, Mary, I'll turn it back to you.
All right. Well, just really quick, Nikki did a great introduction of who I am and where I'm from. So I'm the Children and Family Services Director at EPI, which means several things. I manage the Child Care Resource Referral Contract for Northeast Iowa. I also manage a Child and Adult Care Food Program contract for 6 counties in this area. And then also new to our agency within the last year and a half is a partnership with Hawkeye Community College, where we offer childcare services downtown at the Van G. Miller building, which I believe I've talked to this group about before. So anything childcare, that's my specialty and my most favorite thing. So Angie kind of gave a little bit about the history of why we came together. Angie was really the lead on that. She contacted us. I was on a beach in Alabama when this pandemic broke out. I recommend to no one to go on vacation when a pandemic is breaking out, because it really makes your vacation go south very fast. So, but I love that Angie reached out to myself and a few others just to say, hey, can we really start thinking about this and looking at convening this work for our community? So we did just that. They did a lot of work while I was still down south alongside of my staff, just to really get our baseline and where we wanted to go. We knew a lot of things in the beginning, and one of the things that we knew is that childcare was going to be one of the most top priorities for our community. We, I think, thought as a group, and at least I did, thinking we were really going to probably be looking at needing some emergency childcare placements. So meaning we would need to open up some new sites to serve primarily that school age group, because school was closing for a time being at that point. And where were these kids going? I think we went into this thinking we'd probably look at our schools and we would place kids in those different spots. But as you're going to hear, our work it didn't turn out how we were thinking our plan, how the plan would be in place. And so we've done a great job of just finding what our needs are and helping our community in that area. So Jane really, from the beginning, talked a lot about that tier work and what that tier work was going to look like. So from the beginning, we based our work on that. We really went into tier 1, which was matchmaking. So knowing and trying to find out what families' needs were around childcare. Angie is our Google expert. She can put together anything in Google. She put together a Google shared file folder for us, and then this survey that I'm gonna have her talk about in a little bit. So that's really our matchmaking stage, where we looked at sending that survey out community-wide. We sent it out through Grove Cedar Valley. All of our contacts kind of pulled together all of our partners and said, hey, let's get this out there and find out. To date, we have looked, we're still keeping that survey open, and we've contacted a little over, I think 130 families have come back through that survey to ask questions or also receive a referral. That referral is done through our office at Child Care Resource and Referral. Brenda's on the call today. She's definitely one of our, she's our data queen / referral queen / everything else to look at managing that and tracking those responses. So she works alongside of our staff and leads that effort for us and communicates anything back to us. We then looked at what tier 2 could be, and tier 2 is where we thought, well, this will probably be where we're going to see the need for school age increase, and we're going to have to look at some emergency childcare sites and placing these kids. So we would have held those children in probably our local school districts in our buildings. The school districts work together to then kind of designate buildings that they would do those services in to offer quick emergency sites. We had an MOA conversation started with the Department of Human Services on what that would look like, just to be prepared for that moment. And then tier 3 was really opening up new childcare sites. So what's existing out there and where could we technically open up new full childcare sites for all ages. I will tell you today, we're still in tier 1. So that is where we're at right now as far as that matchmaking, where the survey is still live, it's still out there. We're working alongside of anyone that has needs for childcare. And then on the other side of it, childcare resource and referral, and Brenda's really the master behind this, is she's working with programs on finding out when their reopen date is. And so when we can expect those programs so that we can feed that data to be updated each week. So that's a little bit about our tier work. I don't know, Angie, if you want to add anything in, but if you want to go into talking about our groups really quick.
Sure. One thing I'll add to kind of how we got going, especially with this framework of the different teams that we have at play here, is that very early, like during that spring break week, I was starting to get contacted by both local hospital systems, both Unity Point and Mercy, and they were really ramping up and believing that they were going to have a significant childcare need. And so one of the things we realized right away was that there were kind of multiple separate efforts going on to try to gather information from essential personnel and determine who needed childcare and what kind of childcare setting they preferred and those kinds of things. And so one of the things we wanted to do right away was to wrap this all under a community-wide effort. And so we tried to kind of engage all the individual efforts that were occurring. And that included on the provider side, because we were initially providing some information to the hospitals, and then just wanted to step back again and kind of zoom out and coordinate across all of the different efforts. And so out of that, that's really where the childcare, the Blackhawk County COVID-19 Childcare Response Initiative grew. And so we organized ourselves right away with the steering committee. And it was interesting because one of the reasons we were meeting during spring break week, we already had a scheduled meeting with myself and the 2 school districts and then a couple other childcare providers in town who do after school programming at the schools, was to determine what do we do in the coming weeks with after school programming, because we didn't know at the time that schools were going to be canceled at that time. So that's what we kind of initially were talking about. And then as we just had these conversations about all these other employers and people, that's where we knew we needed to get organized. So that's how the steering committee was established. And then we knew right away to bring, we needed to bring CCR&R in as well, of course. So we pulled Mary back from her vacation a little bit, started sending her all kinds of emails to respond to as we were getting organized. And so as we brought form to the different groups that were going to be engaged, one of the core groups was the provider group. And that was all childcare providers who wanted to be engaged in the initiative. And part of that too was helping childcare providers access the resources and information to make sure to establish the protocols, to be able to have the supplies and those kinds of things to respond to the ever emerging. I mean, for the first 6 weeks, it felt like every week there was another layer of protocol and guidelines that we were following from DHS or Iowa Department of Public Health or so on. And so, and then there were not just the protocol and safety concerns, but there was also the financial concerns and all of the relief that was coming out from the both state and federal government, and how to navigate those options and those opportunities. So that provider group really allowed the childcare providers across our community to come together and to discuss all those different topics, and really also to keep a pulse on who had slots and help people as they were considering whether they should be closing or not, and those types of things. And then we also had the employer provider connection group, and that's where we again, brought in those employers who were reaching out and saying, we think we have urgent childcare needs. And so we had, representatives from the hospitals and some other employer groups. We had lots of government representatives on that, everything from some of our state representatives, senators, to the local mayors were engaged in this. Blackhawk County Health Department, Blackhawk County emergency response or management agency. So a lot of different people kind of coming at the table for some of those conversations. And that was fruitful in many ways. Number one, to then develop this one master survey that could be sent out through multiple employers. And so we did that, and we're able to get kind of just a central line for employers to use so that they didn't have to manage all that internally themselves and then figure out who can provide care for our employees. It was really routed, and then CCR&R could do that matchmaking piece of that. But it was additionally helpful because in those employer provider connection group meetings, we were able to, communicate with government officials, and in some cases get some advocacy work done or some questions answered about state guidelines. We were able to connect more closely with Blackhawk County Health. And so they were able to help inform some of our practices and, provide feedback and advice on how we manage things within our centers. So it was and then of course we were connected to the many of our local funders, including the Community Foundation, were linked into that as well. So they were informed of what was going on across the childcare providers. So it's been a really interesting collaborative effort that came on very fast. We put legs under it, I think, very quickly. We're, like she said, we're still in tier 1. And so that the need didn't end up extending past the availability that we already had. And in fact, many providers have seen lower numbers than they expected and have been managing through that as well. So, but I think that we can be really proud that we were able to bring things to a place where we really would have been able to respond to an overflow of need if there had been that. And I'll also add to that I don't think this is done yet, because now we're looking at the summer and we're looking at a different phase of our work, which is now we're looking at people going back to work and kind of emerging back into quote unquote regular life, whatever that means at this point. And so as we see more and more families starting to work potentially outside of the home or working at home but needing a care option, I think we're going to see a gradual kind of ramp back to, people seeking regular care again. For those who may have just decided to keep their kids at home and to work at home and they have that option, we might see that starting to shift a little bit.
Definitely. A little bit about the provider community too, and it's been really interesting to meet with that group week after week and just hear their needs. And one week I remember hearing from them that their numbers were so low and that there was a few of our childcare centers that were thinking of closing their doors because they couldn't keep the doors open with 15 children per day and to pay staff. And then the paycheck protection plan was coming out in that week, and a lot of them applied for that. And then the next week on our call, you heard numbers were up and they had received the approval for their paycheck protection, and you kind of heard a little sigh of relief that they could pay staff and keep those doors open, which was great. And it's just interesting how each week their lives, it changes definitely for what they're seeing with trends. We have a little bit of data that we can share today too, and also with our childcare providers. I can't say enough good things about my staff and all the work that we've done in the last how many weeks, and 11 weeks, and how our world has just changed. They're doing everything from drop-in dashes where they're dropping supplies off at the door. We've partnered with the Department of Human Services, who is our funder, to they have basically said, whatever you need, pay it, and we are providing the financial reimbursement to you. So we had a lot of hand sanitizer going in and out of our door, spray bottles, thermometers, gloves. We had a lot of people sewing masks, which child size and adult size, which I can't say thank you enough. We had such great support from Community Foundation of Northeast Iowa and Kay and her leadership as far as checking in and saying, what are the needs and connecting us to these groups, and then talking to them about the fund that was set up to our providers just to recommend that. So we can't say enough good things about our partners at Community Foundation. But it's just been a crazy world. But when we look at our childcare providers, we really look at them as a hero. And Angie's included in this and all what the Y has done. Also for our community, this in the next few weeks, you're going to start seeing around town some childcare hero signs, and you might already start seeing them in front yards or in our providers in the front of the buildings that they have these facilities. And that's something that Childcare Resource and Referral has just done in the last couple weeks, partnered with Karen's Print Right and helped a small business as well to do the printing of that. And then we're placing those in our 19 counties because we just want to thank our childcare providers for everything that they're doing and keeping those doors open. And they're definitely putting their lives at risk, but are providing amazing care. So when we look at data across our region, and this all is coming from our data queen, Brenda Loop, right here, and this data changes, as Brenda will tell you, daily, probably hourly. But this is currently, as of last week, what we're seeing. So 44 programs are open and enrolling children. That's around 325 spaces that are available for children. It gives the breakdown right below there on your screen about our non-registered homes. Right now we're 0 homes that are open and enrolling children. And those are non-registered childcare homes that are accepting childcare assistance. We then have 37 homes that are registered homes and have 142 openings, and 7 centers in Black Hawk County open and enrolling kids with 183. We also have 90 programs that are still open, but they're not enrolling new children. And you'll see the breakdown there. The reason for that is a business decision for them. And we totally understand that and respect that they're caring for the children that they currently have enrolled and not taking on any new children just for the safety and that decision. So we track that information also and track how it will change too as their enrollment goes up as well and back, hopefully to normal. 75 programs that are temporarily closed. So that's what you're seeing right now in our county of who's closed. Breakdown of that is 2 non-registered childcare homes, 8 registered child development homes, and then 47 centers with the capacity of almost 2,438 kids. So that's a big number there. And then we have 18 Department of Ed preschools with the capacity of 547. So that's your preschools that are within our school districts that they closed and followed the school schedule. What we're doing as an agency is really following up with these programs. We're tracking open dates. We're tracking what their plan is. We're also looking to support them in any way to open again. So right now what we know is that everyone is reopening. So knock on wood, let's hope that continues, right? We need that. We were in a crisis before COVID-19. So we definitely are going to be, our crisis is, I call it the new childcare crisis right now. So we're definitely supporting them in any way. Visiting with legislators, I talk to our federal and our state partners all the time just about what their needs are as far as childcare, how we can support them. In the last few weeks, what we've seen is the CARES Act was released for childcare. So Iowa received $32 million. That is, there's a breakdown of different stipends that programs are receiving, but programs that are still opening and offering care are receiving monthly stipends from the Department of Human Services, which is huge. All families that qualify for child care assistance and are enrolled in a child care, if they're not attending, their space is still being paid in full. So that is huge for programs. And that starts, all this funding starts in April through August or through the end of July. So they'll be paid for each month. And then the other grants that they're offering is if you're providing a discount to essential workers, and DHS has an approved list, you're also receiving an additional stipend each month for offering that. And then the last one would be the rejuvenation grant. So any program that we see within that 75 number there that will be reopening, they'll qualify for a stipend to open those doors back up for cleaning supplies and just general expenses. So that's been a huge relief for people. We saw a lot of programs very grateful that it's just a stipend going right back to them. It's not necessarily saying, we'll give you 10 gallons of hand sanitizer and this and this. It's that dollar amount that they need to make up for that loss that they've had. And then really next steps. I mean, I think Angie, you covered it well in your last sentence there, was saying our work isn't done. We as a steering committee are going to meet hopefully next week to really determine our next steps. I think we're hearing the need for more childcare as our businesses start to reopen and things start to change. I know I've received a few phone calls this week from HR directors that are from some pretty large companies that know me, and they're like, so what's going on? When are these childcares reopening? What can we do? So we're definitely offering our childcare referral line service. We're giving a flyer out that shows that information and that they can call. The survey for Blackhawk County is still live, so we're sending that out. Today, the SHRM group, which is our HR group, they're going to be receiving the flyer of all of the child care resource referrals information. So that's great. And we're just going to continue to elevate the conversation and support both businesses and child cares as we see things reopen. And I think the thing is summer care too. And I don't know, Angie, if you want to talk a little bit about summer care, but we're seeing some programs not reopen for the summer. So our school age kids we could see a huge need, and we can almost see us moving into tier 2 before we know it. I don't know, Angie, if you want to add anything about that.
Sure. We, during the duration of this, we had capacity to take more kids. So as we converted spaces and those kinds of things. And, one of the things about navigating the past couple months is that I can speak from the WISE perspective, which is that we made a commitment to stay open for emergency childcare kind of no matter what. Even though financially it is definitely a strain, because we, under the guidelines or the recommendations, you operate with lower groups of kids. And so whereas a normal school age ratio would be 1 to 15, we are typically in a 2 or even 3 to 10 ratio right now. And part of the reason for doubling up staff too is to decrease the amount of crossover between various staff members with a group of kids. So we're very careful to have a group of 10 or less kids together and they don't see other kids or do activities with our kids the whole week. And likewise, we assign, the 2 to 4 staff who are going to be with that group for the week, and we don't cross over. And so we wanted to have enough staff to they could break each other so that we didn't have a roamer. Normally we'd have that kind of other person who would go and break various classrooms at different times, but we didn't want to have, again, that crossover happening across different rooms. And so the staffing is much more intensive for what we're doing right now. And we anticipate that going into the summer as well, and keeping those group sizes lower as well. So one of the things we're facing with that, the why, is we already had summer registrations in play for the summer under a normal summer camp circumstance. And our normal summer camp circumstance would have, still following 1 to 15 ratio, but more kids in different areas together, larger rooms. And so we are having to definitely decrease our capacity. So we've been zeroing in on that the last week or two, because we need to find out which families were still intending to do summer care. And what we're finding is that we're probably about 20 kids over what we will have the capacity for at this time. And so we're getting ready to do another round of survey out to families so that we can ask them questions about the nature of their work. Are they essential personnel? Are they currently working? So that we can follow a prioritized list again, much like what we did in the throughout this whole process, we followed a prioritized list. It's just going to look a little bit different now. There's some expanded groups on it as well, but we will still prioritize essential personnel, prioritize single parent households where the parent has to work in order to support the family, and then dual family in the same kind of circumstance, and then getting down to as space would allow, those families who may be having one parent working at home or both parents working at home, and then finally people who are not currently working would have under our new priority lists, and they always have, but they would have the lowest priority, because if they are home and able to offer care, we have some above that would need support. So we're getting ready to send that out to families. And so we're looking at this in 2 ways. Number one is the prioritized list approach, so that if we have to start making cuts to registrations, we can do that in a, you know, somewhat of an organized fashion, and be sure to keep meeting the need where for those who, you know, have a greater need for that care. And then the other approach is we're trying to reach out to other facilities, you know, whether it's churches and or otherwise, that could even take 2 groups of 10. So even if we could find a facility that would take 20 kids, and honestly even 10, so that we could start to spread our kids out, and be able to serve all that we have. And then we also anticipate that need is going to increase. A couple of the key school age care summer programs that I know of right now are Cedar Falls Rec is not holding their camp this summer, and then the YW is not holding their camp as well. So those are 2 kind of key players that will be out of this. And you know, the need probably won't be the same as previous summers, because some people will continue to work at home and manage that. But I still anticipate, well, I can tell you just from our numbers alone, you know, we would be, we could serve up to 60 if we maximized every space we have, including racquetball courts. And we've already converted and planned the whole summer to use our Group X room for childcare. And so the steps now are to either reduce registrations or to look at alternate spaces where we could spread some groups out. And I think an additional step for the so that's kind of the why perspective. I think for the initiative, one of the things, and I'm sure Mary is fielding more of these, is that when this, as I mentioned, the protocols and those things are intense. And look, you know, childcare protocol is intense on a regular day before a pandemic, and add on a pandemic, and it is very intensive to get everybody on the same page and to follow those. And so, you know, in the beginning, it was a little bit of a fire hose the first week or 2, and then we got acclimated and we kept adding the additionals that came on. And so we had a little bit of time to ramp up all the way to where we are now. But as providers step back in, you know, they're going to need that support in understanding the new landscape of what it looks like to offer childcare under these circumstances. And that will be a financial stress for many of them, just like it is for the Y, because again, it changes the whole model of number of kids and the staffing costs. And if anyone knows anything about childcare already, the margin is so thin that I imagine that most childcare programs in the next coming months will operate in a deficit situation, because that's just what it is with the costs, and then even the equipment and the supplies costs are so much greater. So, and then especially staffing.
Definitely. I think we're also awaiting some new guidance from Department of Human Services today. We're hoping it's out today or tomorrow on summer care and what that will look like. So a lot of our programs are nervous about that group size. And right now the governor's office had recommended 10 to a group size. It's a recommendation, it's not a mandate, but they're following that, and it is making a huge difference for them financially, but also it's helping keeping everything contained and kids safe. So what does that look like for summer? When these numbers go up, and an example of like Angie's program, what does that look like for her? So we're expecting that to be out soon, and then can guide people on that and help support them. And just the cleaning is a prime example of all of the things you have to do as a childcare provider to sanitize and clean, and now it's doubled, if not tripled, what they have to do. But I've heard from a few center directors, and I think this is interesting, that there's been no other virus come into their program. So they've really done a good job of, and it was our center director down at the Van G. Miller Adult Learning Center. She said that to me last week. She said, nothing, we haven't had an ear infection, strep throat, anything that's common, pink eye, anything, especially in your spring months where you go from cold to warm. And I thought that was really interesting, but there's a lot of things that play there. The staff are staying home, you know, you're double your cleaning, you're doing all those things. And I thought that it's really going to change a lot of practice for people down the road too, and keeping this up to keep all germs out. So I think that's really everything that we have. I can't say enough good things about our support from the school districts. I wish that our two co-parts were, you know, here with us today, but it's been fabulous to have them on this team and hear the school districts needs, because we did think about what the needs were for the kids that obviously in the school district, but also the staff as well. But it's been great to have Jane and Pam willing to, in the early days, opening up buildings and doing things that we would need for space. So we really appreciate that. And I think our work will continue even past the pandemic too, as how we can partner better together. Any questions for us?
There is one in the chat box, Mary. I don't know if you want to answer that, or Angie, but there's one about if a child I mean, it was neat to hear you say that nobody's really getting sick, because I kind of feel like even in my own house, we're the healthiest we've ever been. Like somebody's usually got something by now, like a cold or sniffles or something, but we all seem very healthy because I think we're not touching our face and killing our germs. But if the tragic thing would happen and one of your kiddos and one of these daycares gets the coronavirus, is there kind of a plan to respond to that?
Yeah, there is. So it's actually, we were just talking about this today, Brenda, and in our supervisor meeting for childcare resource and referral, about how I think for our childcare world, we've always been used to a black and white world with regulations to say this is what you'll do. So if the child has pink eye, this is the procedure and this is what they do. But what we're learning with COVID and since the beginning is that it's really a case by case and what's going on. So if there is let's use an example of a staff member being tested for COVID, then there's a plan in place for that where they contact public health. They work alongside us and DHS for their plan. And it honestly looks different for each case. So what we're hearing is that they're not wanting to close down that. They're trying to do everything they can not to close down that program for all children, but it's more in that area where that virus could have potentially been, is to keep that contained and, you know, don't clean that room and do what they need to do and move the children into another space. So there's multiple things that are happening. We're also hearing that if children have a fever, even if it's connected to COVID or not, that they need to stay home and be fever-free without fever medication, reducing medication for 72 hours. So it could potentially put children out for 10 days of a childcare setting. So there's all different, I mean, it could be a whole nother presentation to you guys on all of the different steps. And I'm willing to do this and bring in my nurse friends for this if we need to, but it's very interesting because I think early on we saw people just immediately shut down if someone was being tested. But right now what is happening is there's guidance and there's support to keep them open and provide them some support on cleaning and what they need to do.
Definitely. I would concur on that. Blackhawk County Health has been amazing, and they basically have said, whatever your situation, and I've probably called them, I don't know, 10 to 15 times when it's been, oh, there's a staff member that has a roommate with a cough, and there's a this and, you know, all these different scenarios we've been kind of faced with. You know, we've had a parent who tested positive, and that was still determined to be, you know, Blackhawk County Health led us through that to say, well, that's a third party, so that's not it within your center. And so they're, you know, so they basically walk us through all those various scenarios and make a plan. And so they've been really, really great support. And I really sit here now with just the confidence of knowing, you know, when and if, and, you know, probably likely at some point that we will have a case that we have to manage. I know that they'll be a great support.
Mm-hmm. Okay, yeah, we definitely, you know, statewide we have Healthy Childcare Iowa, which is through public health, and cannot say enough about our nurse partnerships right now and all what they've done. I always tell my staff, we're not nurses and we're not lending officers, bankers, because we've gotten so many questions on this financial piece, and and health piece. So we're so thankful for our partners to pull them in, and then we learned so much too during that time.
There's another question. I'm not sure, Nancy, I know you put in the chat box about, I don't know if you ladies can see that. It's about having older siblings or older kids. I don't know. And Nancy, even if you want to unmute yourself and ask specifically, or if you feel you got your question answered.
I think what she was getting at is that there have been some exceptions, and Mary can speak to it way better than I can, but to allow older kids, primarily siblings, I think was the goal initially. And Grin and Grow did get an exception to that guideline. And I know last time I talked to them, which was maybe 10 days ago, I'm not sure that they actually took on an older child. I don't know if you know that, Mary, or not.
I think they did that early on that exception, because again, we were in that conversation where we know the school age numbers we thought were going to be, that need was going to be high. And I don't know that if they have, it's been low numbers that they have taken on new children. So in that school age, but yeah, that was great thinking on their part too, to expand their services. And who knows, next steps for them on what, if that will continue down the road. But we did receive guidance just literally an hour ago that when the emergency declaration is lifted, that those emergency sites and those exceptions then will end. So programs are being contacted on that, just to let them know. We have under 40 emergency sites in the state where schools opened up temporary sites or churches. So eventually what they're saying is that will be done after the emergency declaration.
We didn't hear how many extra children the Y was caring for since March. Can Angie tell us that?
Sure. All of everything that would have happened here for school age would have been outside of our normal,
right?
Obviously, because they would have been in school. We do have a lot of before and after school programs across both Cedar Falls and Waterloo and Dyke and Grundy Center. So, that shifted away from that. And so we had a handful of kids that were in our traditional school age care program, but I would say primarily we had other families that were seeking care. We caught a number of overflow from centers that closed and needed to find alternate care, and some of those in that essential personnel category as well. And then also our early learning center, which is here at the Y all year for 6 weeks to preschool. We had some of the families that are traditionally in that who kept their children at home. And so we also had new kids within our early learning center. And so now we're part of the information we're trying to gather now is, as their centers may reopen June 1st or June 8th coming up here, transitioning some of those families back to their original center, because we have to start, having the space to bring in the families we've already been serving. So it's a little bit of a, it's a little bit of a finagling kind of deal to get that squared away, but we're working on it and gathering information for that. So I would say we probably had 30 kids that we don't traditionally have.
Well, I think it's just another example of how the Cedar Valley works well together. We've had so many people outside of our community over the years say, wow, you guys are really collaborating and you're really working together. Even to our Blackhawk County Childcare Coalition that's been working, for a couple years. And I think this disaster has just really drawn a spotlight to that work and that collaboration, and kudos to you guys for just being key partners in helping to make that happen and providing that amazing service. And we know that you're not going to go anywhere, and neither are the other leaders on this group, but it will just kind of ebb and flow into, to Mary's point, what does this new childcare situation look like? And we know that it has taken away some of the progress that we had made as a county over the last couple of years. But I think we're also encouraged to know that we are a community that continues to work together, right? So we will keep working on solutions to take care of our most precious little resource and in our communities. So kudos to everybody who's a part of that work, and pretty much everybody I'm seeing is somehow connected to and supporting and being a part of that work. So that's great.
Definitely. Thanks, Kay. It is true. The Cedar Valley just does that so well. We work together, and other parts of the state ask me that all the time. What's going on in Blackhawk County? Why are you guys so good? I'm like, we work well together. That's exactly why we are the best.
Absolutely.
So.
Well, if there aren't other questions, I thought we could potentially wrap up with just a little bit of an update on what's going on with the Blackhawk County Childcare Coalition. So the group that Mary and I and Kyle and Dan have kind of been shepherding, working with, whatever. So, but if other people had questions specifically to the emergency response, I don't want to take our last 5 minutes away from that. Any other questions on that? Yeah, so it's really interesting. Right before Mary left on her wonderful spring break in March, we had a strategic planning meeting with our Blackhawk County Child Care Coalition and working on our strategies and next steps as a group. And we had this great planning session. We talked about where we have come from, what our goals are moving forward, how we could really think about the next couple years and what those priorities would be. And then COVID happened. So we do really have some good plans, good feedback, good information to move forward with. But, and our plan is to regroup that whole committee and kind of pick up where this emergency child care group has led us and talk about next steps. So I don't know, Mary, if you have anything else there that you wanted to add. We didn't plan this, but.
Oh, yeah. We're always good talking about this topic. It's one of our favorites, right?
Yeah.
We definitely, that work is moving forward. I think we're going to see a whole new normal for the coalition too, and getting that group back together when we can, just to kind of maybe revise our strategic planning. And Kay is right. We had a great meeting and we were so excited, and then something happened. So, but one thing I think I just will share is that you may have heard about, we've had a few press releases and some things on our partnership with the Western Home and Western Home Communities, and being one of the first ones. And now VGM has joined into that partnership and having child care centers that their staff would receive first priority, and they would be a partner. So that is moving forward. And we're very excited about that. And Dan Levi and I are working alongside of Sonia Thrall and Katie Morris from VGM to move that forward. And we still have partners, other businesses coming to us that are interested. And we have a name for the site, and we have filed for the 501, and it's going to be called Cedar Valley Kids. So we're very excited about the name and kind of figuring out the branding and all of that. That obviously project's getting, it's a little bit more delayed than what we had anticipated. But yeah, there's just still a lot of great things happening with that project, and it will happen for sure. And we're excited for that. So.
Well, thanks, Mary.
Any other questions?
I've just been told my internet connection is unstable. And I take that so personally. Maybe you can't hear me. Can you hear me? No.
I can hear you.
Yeah. Yes, we hear you. You're frozen, but we can still hear you.
Yes, weird.
Good point, yeah.
I lost my connection. Can you hear me now?
Yes,
Nikki?
I can.
Yes, I am here. Can everybody still hear me? Yes, okay. I will then
Yes.
wrap up. I am just wanting to remind everybody that, again, not sure what the future holds, but as of now, our next Women for Good program is scheduled for September 17th on a Thursday. And we really don't know at this point if it'll be another Zoom like this or if we'll be able to have a chance to meet in person. So I guess just mark your calendar for around the lunch hour on September 17th. And we'd love to have you there. And again, thank you to Mary and Angie for doing our Women for Good program today. I think it was very informative, and we did have pretty good turnout that stuck through the whole thing. So you guys did a great job, and thank you, thank you. So with that, I guess we will go ahead and say goodbye and wish you all well, and please stay healthy. And hopefully, cross fingers, we'll see you all in September. Take care, everybody.